prion diseases? I don't know any of this.
Here we have Kristen, your normal college student who lives in her off-campus apartment that just makes ends meet. Let's observe.
I don't know any of this. I'm gonna fail. Oh my god. Ow!
Kristen has been infected with a common bacteria called Clostridium tetani. This bacteria is a gram-positive bacillus that is an obligate anaerobe, so it grows well within the body. It lives in dirt and other places with no oxygen because oxygen is toxic to it. To get around this, the tetani will produce spores when it hits oxygen. So once it comes out of the soil, you'll see that it'll start to produce spores. So here are the spores, and it's in an oxygen environment. Those spores become adult tetani when they're back in an anaerobic environment. During its growth, it has many flagella that allow it to move. The adult tetani produce two toxins called tetanospasmin and tetanolysin. Tetanospasmin is a toxin that disrupts neurological pathways. It disrupts the neurons that send signals to muscles to spasm. The function of tetanolysin is unknown, but it helps to contribute to the disease. Now, let's head to the doctor's office and see how Kristen is doing.
Hi, I'm Dr. Waters. I'll be your doctor for today. What seems to be the problem?
Well, I stepped on a rusty nail about 10 days ago. It wasn't bleeding too bad, so I patched myself up. I had an anatomy test to cram for, so I didn't have time to come to the doctor's. I've been having weird symptoms recently though, so I figured I'd come in.
When was your last tetanus shot?
I didn't think about that. I had a tetanus shot when I was a kid at like 6 years old, but I haven't had anything since. I should have come in sooner.
It's okay. Well, what kind of weird symptoms are you having?
I have a headache, fever, diarrhea, and a sore throat. My jaw has been stiff and bothering me for a few hours, and it's getting hard to talk.
The symptoms of tetanus include diarrhea, fever, headache, sensitivity to touch, sore throat, sweating, and a rapid heartbeat. The most common symptoms of tetanus are jaw cramping, sudden involuntary tightness like muscle spasms, painful muscle stiffness all over the body, and trouble swallowing. Other symptoms include jerking and seizures in severe cases. Kristen here has some of these symptoms now. Let's take a look at what she has.
Okay, well, I'm going to take your vitals and do a physical exam.
Okay.
Listen to your lung sounds. And your blood pressure. And your heart rate. Okay, well, you have a blood pressure of 140/110, which is high, and you have a heart rate of 110 beats per minute, which is also high. Okay, do you mind laying down for me?
Sure.
All right, I'm going to palpate your abdomen. Ow. Ooh, looks like you have some pain in your abdomen, meaning you could have some muscle tightening in the stomach area. When did these muscle spasms occur, and how often do they occur?
Well, they started occurring about 12 hours ago, and they got progressively worse and more dramatic as time went on.
Well, these are all telltale signs of tetanus, which is caused by the bacteria Clostridium tetani.
Oh no, do I have tetanus?
It is possible. We're going to monitor your behavior for a while. There are no lab tests I can do, though, to confirm it, since ovulate anaerobes are slow and hard to grow in a culture. You most likely have the form of generalized tetanus because the symptoms you are showing, which occurs in 80% of cases. I'm going to administer a human tetanus immunoglobulin.
This is an IgG antibody injected into patients as therapy. It can only neutralize the toxin if it hasn't attached to the nerve tissue yet.
Administer a drug for your muscle spasms, antibiotics, and most importantly, a tetanus shot. With these treatments, you should feel much better. The muscle spasms may continue for 3 to 4 weeks, and complete recovery from the disease may take months.
Dr. Waters, I think my jaw is tightening up more and I can barely speak. Help!
I'm going to administer a benzodiazepine for your muscle spasms, which should help with the lockjaw. This is a combined muscle relaxant, anticonvulsant, and sedative. I'm writing you a prescription for a diazepam, which is a common benzodiazepine. Should be covered by your insurance for cheaper, but a coupon on GoodRx can bring the price down to $5.47 if you don't have good insurance.
Diazepam is a long-lasting drug because it is lipid-soluble. If too much is administered, it could lead to metabolic acidosis, in which propylene glycol builds up. Reasons to not take this drug are alcoholism, drug abuse, glaucoma, COPD, liver or kidney problems, sleep apnea, pregnancy, or if you are breastfeeding. Contact your doctor to see if diazepam is right for you.
You shouldn't take if you have an allergy to benzodiazepines. Do you have a history of any of these contraindications?
No, I think I'm okay.
Well, antibiotics will be administered to keep the C. tetani from reproducing at the site of the penetration. The common antibiotics for C. tetani are penicillin G, metronidazole, and doxycycline. In large doses, penicillin can cause seizures due to it inhibiting the GABA-A receptors, and the bacteria could be resistant to it. So I'm going to administer metronidazole.
Most cases of tetanus in the U.S. are caused by patients that have never received a tetanus vaccine or didn't stay up to date with their booster shots every 10 years, like Kristen in the example. The DTaP vaccine, or diphtheria, tetanus toxoids, and acellular pertussis vaccines are given as a young child between 6 weeks to 6 years of age and is given in 4 doses on a set schedule. Tdap is given at 11 or 12 years old, with booster shots every 10 years after that, or when possible exposures occur. Tetanus toxoids work by inserting a dead version of tetanus into the patient to stimulate the production of antibodies against it. Overall, the demonstration is how tetanus should be dealt with. But this is what could have happened if Kristen waited much longer and come in with more severe symptoms.
Oh no, Kristen, are you okay?
The type of facial spasms associated with tetanus are called Sardinian grin, or rhizus sardinicus, which is where the facial muscles lock up into a grin. One of the tests conducted to determine if a patient has tetanus is to insert a tongue depressor into the mouth to see if the patient bites down on it. This is called the spatula test. This all-body spasm is called epistetonus, which occurs when all of the muscles contract at once. It's important to note that these spasms only occur in skeletal muscle, so smooth muscle and cardiac muscle still function as normal.
We need to maintain the airway and get some meds to help with the seizures and spasms. Stat! Time of death, 22:31.
But luckily for Kristen, her symptoms were found early and she made a full recovery.
There are other forms of tetanus that we did not get to see acted out here. For example, neonatal tetanus occurs in newborn infants when the mother is not immune or vaccinated. Infections of the umbilical stump can cause this form of tetanus, and it is common in developing countries. Home delivery of a baby may cause this tetanus, as the cutting of the umbilical cord is unsanitary and could lead to infections. Cephalic tetanus is rare, and it's associated with ear infections if Clostridium tetani is found in the middle ear. It is associated with muscle spasms involving the cranial nerves. It's usually caused by head trauma, such as tooth extractions, eye injuries, and skull fractures. This is the deadliest form of tetanus.
The most common form of tetanus, and the one that Kristen had, is generalized tetanus and accounts for 80% of cases. The first symptoms are lockjaw, followed by stiffness of the neck, difficulty swallowing, and rigid muscles. Other symptoms are described previously in the video. Local tetanus is another uncommon form of tetanus where the patient has muscle contractions in one area of the body. This can proceed to generalized tetanus.
Other than rusty nails, there are other ways to become infected with Clostridium tetani. We brought Kristen back from the dead to demonstrate.
One of the ways to get infected is severe burns or infected tissue.
Ah!
Wounds contaminated by dirt.
Let me just rub some dirt on my cut. That's better.
Feces or fecal contamination. And spit.
That's not in the script you gave me, no!